Good morning, everyone. I think we're going to get started just a few minutes late, but we'll try to get everything back on track. My name is Katha Forche. I'm assistant to the National President of Unaffordability and also an RPN and former healthcare worker. And I'm very pleased to be here with you all today, and thank you for coming. Welcome to everybody that's here, and of course, we're here to support the wonderful work of the Ontario Health Coalition. I don't know where we'd actually be in this province without them and the work that they do on so many different things. I often tell Natalie that sometimes it's almost too much for the amount of work that they produce, the documents they produce, the tours they go on. It's just incredible work. But fighting for Medicare, fighting for a better Ontario, fighting for protecting our hospitals and better long-term care, it really is amazing work. Okay, and we're going to introduce our first agenda item. We have the myth of healthcare and unaffordability. We have a researcher from CUPE who of course sits on the board of the Health Coalition, and he's again been focused on healthcare for more than 2 decades. He holds a master's degree from York University, and he's the author of the popular Defend Public Healthcare blog, where he explains economics and health policy in plain language. And again, he's a passionate advocate and activist, and he spent his life dedicated to promoting equity and protecting public health care for all. Doug sits on the board of directors, of course, of the Ontario Health Coalition, and we look forward to your presentation. Welcome, Doug.
I never heard my blog described as popular, but there you go. Thank you. That was very kind. Usually when I speak to events like this, I feel like I'm the voice of doom, because I'm usually paid to bring the problems. But this time is kind of unique and different in the sense that I think we can talk of some rising expectations, some rising possibilities that I think Katha alluded to. But this really is the time to push and the time to press, because we do have a real opportunity to make a difference. We have made a significant difference in the last year and a half, but more possibilities present themselves. So, context. Deficits had been overestimated for the last 8 years in a row. Ever since since 2010, significant overestimation of the deficits, contrary to what the claim has been, that the deficits wouldn't be rolled down, the provincial deficits wouldn't be rolled down and defeated. They actually have been overstated consistently, every year overstated. Last year alone, they overestimated the deficit by $3.3 billion. It fell to less than $1 billion. The year before that, overestimated by $5 billion. So there's a sort of a continuing pattern there that we see on that. So contrary to those who complained that the deficit was insurmountable, the real story is that it's been consistently overestimated, and that the problems have been overstated that arose on the fiscal basis. So on to the deficit shrinks slide.
Thank you.
Yeah, I guess I should say that.
Yeah, it helps.
Natalie got me to bring one of the projectors, so we're, as everything, it's done on a shoestring, and that's part of the way it's done. So deficits shrink. The deficit now is less than $1 billion. For the last year, 16-17, was less than $1 billion, $991 million. Well, actually, I've already gone over that. So the economy growing. The next slide is Ontario's economy is expected to grow over the next continue to grow over the next 2 years. The Ministry of Finance is forecasting real growth in Ontario of 2.8%. 2.8%. That's above and beyond inflation. With the budget, and they've re-estimated growth in the following 2 years from their budget estimate of 2% to 2.2%, with increases in nominal growth, which will also drive revenue. So significant gain. You can see that the trend has been upwards in terms of real growth. Last 3 years, 2.7% average. Real growth is expected. The previous 4 years had only 2% growth. And then, of course, the recession before that. So we've had very significant growth. In fact, Ontario has had, over the 2014-2017 period, better growth than any G7 nation. Better growth than any of the big developed nations. We're now, the GDP is now 21.3% higher, 21.3% higher than the recession low. Clearly, working people have not seen that 21.3% growth. They haven't seen anything like it, and public health care certainly hasn't seen a 21.3% improvement. Maybe a 21.3% disimprovement, but certainly not a 21.3% improvement. Somebody has gotten that money. And now, especially as growth and the fiscal situation returns to a better situation, we have to seize it and fight for a significant improvement. Ontario, next slide, Ontario becoming a half province again. For decades, Ontario was a half province, relatively a rich province in Ontario compared to the rest of Canada. In 2007, that began to change. Ontario became a have-not province and began to actually, and quite incredibly, to receive equalization payments from the federal government. That has ended, or is ending, I should say. Conference Board expects Ontario to become a have province in the 2018-19 year. So that is coming up quickly. For the last 31 months in a row, and this chart shows that, unemployment has been lower in Ontario than it has in the rest of Canada. It's now, as of October 2017, is at 5.9%, significantly below the federal level. So the situation is changing, again, on that level. The next slide, return to balanced budgets. The government is not only forecasting that this year will have a balanced budget, this year which is now almost over, but the next two, they are claiming will have a balanced budget for 18-19 and 19-20. Very importantly, the debt to GDP, debt to the size of the economy, is the provincial debt to the size of the economy has begun to decline. We're now in the third year of that decline. From 39.3%, we're now down to 37.1%. That is basically a measure of the ability of the provincial government to meet its debt obligations, and that's as that shrinks, the power to make improvements in public programs improves.
Next slide.
Next slide. Health remains below 40%. Remember that commission, the Drummond Commission, who said Ontario was going to, healthcare was going to go up to 70% of program spending? In fact, it has actually declined in the last few years and still remains below 40%. The hysteria was wrong. In fact, in the 2017 budget, where we did actually a little bit better in terms of healthcare funding, the rest of program spending actually went up twice as fast as healthcare. 6.2% increase for non-healthcare programs, 3-point-odd for healthcare. So actually shrinkage. And the next slide, new spending. So fall of 2016, halfway through the fiscal year of 2015-16, there was a significant change in direction from the provincial government. In the past, for many years, what they had done is they had underspent their budgets underspent the budgets, especially in healthcare. Year after year, they would actually underspend the budgets. Despite our complaining or campaigns, they would actually underspend, usually by hundreds of millions of dollars. But September 2016, big change happened. And we began to see in the middle of the fiscal year, budget announcements of spending increases. We saw that through hydro. We saw that through childcare, very significant and positive increases on childcare, but also, and this is where it gets very interesting, because this government had campaigned for years essentially against hospitals and against funding public hospitals. They began much more quietly than their fanfare around hydro or public health care, than childcare. They began refunding hospitals, and eventually, ultimately announced $236 million in-year increases, mostly for hospitals. Significant, but rather quiet change. They began to recognize and quietly, publicly speak about the capacity problems in our public hospitals. And I think the Health Coalition can take an awful lot of credit for pushing that. A government that was committed against public hospitals began to actually spend. And this is actually an exact replay of what happened under the Harris government of the 1990s, where they specifically campaigned to say they were going to take $800 million out of hospitals, did take $500 million out of their annual budgets, and then just quietly began to fund hospitals again. I remember when I first saw it, I couldn't believe it. Like, what's going on here? Is this an error? But in fact, they had begun to fund it. Something similar happened there. At that time, we saw a significant, in the 90s and into the early 2000s, we saw a significant improvement in the capacity of the hospitals. That changed when the Liberals came in. We saw a different policy, but now, again, we're beginning to see public hospitals with not sufficient funding, but a break from their 0% funding or 1% funding increases. Significant. And then we did it again in the budget of 2017, where funding was increased to over 3% for hospitals and for healthcare. That was a significant change in policy. But even just as important, we then get, again in September, an announcement of $100 million a couple of weeks ago for hospitals, and specifically for hospital beds, which is an issue we've been campaigning on for a long time. 1,235 new hospital beds, 700 other beds, other types of beds and services, $100 million, plus $40 million for home care. Again, the government's claiming, and we're going to have to look at the details, they're claiming, when we get them, that this is new money. $140 million, that's a pretty good day's work, $140 million to get that in year. But it reflects what is going on fiscally and economically in the province. And also in that, we saw just in the fall economic statement that came out a few days ago, we saw the tax cuts for business, which again raised their head. So the question is, and this is the next slide, where is the money going to be spent? Well, I also make mention, because there is quite a few trade unionists in the room, is that the government also moved off their net zero policy for bargaining settlements. We had had many years of hospital workers, school board workers, other provincially funded workers getting settlements below inflation, below municipal settlements, below private sector settlements, below even federal government Harper settlements. That now is back to the same range as those other groups, and also pretty much reflects inflation. So that's a big change as well. So the question is, who's going to get that bounty? We have, and the Health Coalition has campaigned very effectively to seize some of that, to get it and drive it into public health care. It was notable in the fall economic statement when you saw all of the in-year funding increases that by far healthcare got the biggest chunk, by far. So that's, I don't want to play off any other very important public services, but I think it's something that does reflect the work of this coalition and the work that we have to do in the future to keep public health care front and center. So there is this significant question of who will get it. Healthcare, social programs, tax cuts, business support of various sorts. We have to be on the wicket there. So on healthcare spending increases, I think I've mentioned that. The current plan for next year, for the 18-19 fiscal year, is to increase public healthcare spending by 4.5%. That's a significant increase. That's 50% more than the 3% that was agreed to this year. We've pushed that 3% up to probably about 3.4, 3.5%. But now we're chiming in at 4.5. That's what we've got them to promise so far. We've got to make sure they stick to it, and we've got to make sure that there's some extra gold there as well. And we also have to make sure where that money's going, for a reason I'll get to in a little bit. And notably, right after the election, by coincidence, that funding increase is expected to go down to the level we're currently at. So that's another problem that we have to deal with. We've got that opportunity before the election. The election is going to happen in June 2018. After the election, if there isn't a minority or if there isn't a progressive government, our leverage is going to be decreased.
Next slide.
And then more can be done. That's an easy one. And then on to the next one, tax cuts, reduce fiscal room. The 2014 budget, and this is part of the struggle that we're over, it actually bragged about $9 billion in corporate tax cuts that the Liberals had done in the last few years. Just to give you a taste, $2.3 billion annual tax relief for the corporate income tax, the elimination of the capital tax provided, according to the provincial government, $2.1 billion of annual tax relief. And this is like nothing new. There was huge, even bigger tax cuts under the Harris government that these build upon. Absolutely contrary to what you will read in your papers, conservative papers, is that Ontario is not some free spending, tax raising jurisdiction. In fact, Ontario has very low levels of revenue, of government funding. We actually have the lowest level per capita of revenue of any of the provinces. The lowest. So all that blarney you hear from the Fraser Institute about government run amok with taxation, complete crap. Complete crap. Ontario is also a very low spending province. We're actually the lowest spending province of all of the 10 provinces, significantly below.
You're good.
And then we're on to, we're on to the slide after the one that says low spending levels. It doesn't have a title.
Next slide, Chairman.
Yeah. So if we had the same own source, i.e. tax or government corporation revenue as other provinces, we would have, and this is just based on 2009 data, it's a little problem updating it, but we'd have an extra $19.5 billion just to fund our social programs. That's if we were like the other provinces, based upon as a percentage of the GDP. We are a low revenue province. If we also are blighted by the fact that the federal government gives relatively little money to Ontario. So the gap is even bigger if you look at total revenue as a percentage of GDP. We're a full 8.5% of GDP behind the rest of Canada in terms of total government revenue, tax revenue, government corporation revenue, federal fiscal transfer revenue. 8.5%, if I can read it, 8.4. if we got that money, if we had the same level of total revenue as the other provinces, we'd have $46.8 billion. I'd be calling for a tax cut at that point. That's so much extra money. No, I wouldn't, but I mean, it's a lot of money.
But we're competitive now, right?
Yeah. $46.8 billion if we were like the rest of the other provinces. The major reason, the major explanation for our low spending and low revenue is because we have low healthcare spending. We are the lowest healthcare spending province in Canada at $3,955. I have another. The Canada-wide average is about $4,300. If you actually took out the other provinces and just looked at took out of Ontario out of the rest of Canada data, the difference is 15% more spent in all the other provinces on healthcare than Ontario spends. An extra over almost $600 per person extra is spent on healthcare. So we have 15% more dollars spent in the rest of Canada on healthcare than in Ontario.
Two provinces.
That would mean an extra $8.15 billion for healthcare. We could solve a lot of problems with $8.15 billion, let me tell you.
Next slide.
And then finally on to the capacity crisis. The result of this is telling. We have fewer hospital beds than any developed nation. Fewer hospital beds than any developed nation. We have sky-high hospital occupancy rates, way beyond safe levels. We have fewer RNs and RPNs in hospitals than in other provinces. We have fewer hospital staff generally than other provinces, and we have fewer long-term care staffing than any other province, or than the other provinces, significantly fewer long-term care staffing. That's why we can't have a true 4 hours of nursing and personal care, worked care. We did make some progress on that. That was one of the steps we made, but we still are short of a true 4 hours work, nursing, and personal care that exists. And that goes into, that's part of the price that we pay for having that low funding. We have low staffing, low capacity, and constant problems, constant attacks on our smaller hospitals to close or reduce services especially. So there is, the economic and fiscal situation has changed. Politically, we're really well set up up until June to achieve more. We have a budget that's coming out soon. We have potential to make a difference in a way that we haven't made a difference for a long time. We've got great potential. And we have a province that is underfunded and under-revenued, if that's a word. And we are beginning to make progress, but we've got to make more, and we've got to do it quick, because that political circumstance may change very shortly. So thank you. If there's questions, I take them. Otherwise, we'll move on to other stuff.